Okay, so hi everyone and welcome to this event hosted by Doctors in Distress called Reflective Spaces, Nurses Care, We Need Care Too. It is great to have you all here. My name is Susannah and I am Programme Lead for Doctors in Distress. So to start off with, I just wanted to tell you a little bit about what Doctors in Distress does and what to expect from today and from our programmes. So as a charity, Doctors in Distress works to lower the rates of anxiety, burnout and suicide in all health professionals. And we do that by bringing people together to talk about the emotional impact of their work in safe, facilitated spaces with people who have experienced very similar things to them. So as you'll all know, this is an event today for any nurse, HCA, midwife, occupational therapist, or physio in the UK that has been shielding and is now returning back to work, including women that have been on maternity leave during the pandemic. So in terms of how today will work and the programmes will work, we are going to start today with our webinar, and we are very lucky to be hearing from two brilliant speakers, Amy and Fidelia, who are going to share with us later about their experiencing of shielding during the pandemic. And then following this, we will run 8 small facilitated groups run by Mary and Fiona, who you can see on your screen now. And you will be in a breakout room for these groups with no more than 20 people, where you will just have an experience to share. We hope that it will give you a chance to talk about everything that you've experienced, share some of your anxieties and concerns, and learn and support each other. So a little bit about our speakers before we start. So we're going to hear from Amy, who has had a baby during the pandemic, which is really exciting. Congratulations, Amy, and also has had to shield. Amy was a neonatal critical care nurse, but has had to change her role since the pandemic started. But I'll leave you to tell us more about that, Amy. And then we're going to hear from Fidelia, who is a matron midwife at Barts and has also been shielding in this time. And then after, we will hear from Fiona and Mary about our groups. So just so you know, the chat box is open, questions are open. Please feel free to write any questions you may have for any of our speakers or about the groups. I'll also put my email in there if you want to speak to me about anything or check anything, please do feel free. So I think that is everything for just a little introduction. I'm going to pass over to Amy, and then we will hear from our chair of our charity, Clare Gerada, as well. So Amy, over to you.
Hi, thank you so much for having me. So to give you a bit of an idea as to how the pandemic's affected me, it kind of makes sense to tell you a little bit about me myself. So before I was a neonatal nurse, I'm dual trained in adult critical care and neonatal intensive care. So I do the very big and the very little people quite easily, and I very much love that part of my job. And in 2019, I got diagnosed with a very rare immune condition called mast cell activation syndrome. And that, because not many people know what it is basically my immune system decides to go out of control whenever it likes to whatever it likes. And it started with a cold. So I had a bad cold, I went into anaphylaxis for no reason, stopped breathing, and it was all very scary. And that happens quite constantly in my life. So it's been very difficult to kind of manage. So when I found out I was pregnant at the end of 2019, and it was all very lovely and exciting, and thankfully Rupert is a very happy, healthy little boy. But we had not only had we got to deal with a high-risk pregnancy, but come the January, COVID became a thing. And I remember sitting in an NHS assembly meeting with Claire, listening to the big top people of NHS England going, yes, this is a real thing, and we do need to be quite concerned about it. Little did I know, a few months later, I would be stopping work. I would be sat at home, not being able to leave my house. So this was prior to pregnant women being classed as clinically extremely vulnerable. I was vulnerable based on my very dodgy immune system, which just would not have coped with COVID at all. So it was very difficult. From my last shift was a night shift, and I remember we had a lady come into the maternity unit who was clearly COVID, and everyone was quite worried because they didn't know if I should be going in or if I shouldn't. And it was very stressful. And then the Monday morning, I got the text message through from the Department of Health going, stay at home, don't leave your house unless you absolutely have to. So I spoke to my boss and they're like, yep, that's fine, stay at home. And I was like, I'm going to need something to do for the next 6 months. I'm going to go bonkers in my house if you don't give me something to do. And they very much turned around and went, there's nothing you can do, just stay at home and relax and enjoy your pregnancy, which would be fine if I could actually go out and do anything you're supposed to do when you're pregnant, like have yoga or swimming or, you know, anything. But there was nothing. There was no family support. My family live a couple of 100 miles away, so it was literally myself, my fiance, and a rescued greyhound in the house, who now has very bad separation anxiety because of it. So that's a whole other world of problems to add to COVID life. So instantly overnight, all of the support networks that I had gone. So my family, I wasn't able to talk to them apart from FaceTime. I wasn't able to talk to my friends because they were all nurses, they were all busy, and I wasn't allowed to leave my house, and that was really difficult. But I also had this overwhelming sense of guilt and loss of identity. So I felt you saw the news, you saw nurses doing amazing things as they always do. But I wasn't able to be part of that. I wasn't able to help. And the one thing that I think as an intensive care nurse is you sit there and watch, and all you want to do is jump in and help, and I couldn't. So I felt really guilty. I felt that my skills just seemed to not be important. So although I'm a nurse and I'm a frontline clinical nurse, they didn't feel like they had any role for me outside of that. So it was just like I was a nobody, and it was, you stay in your house and you don't get ill, and that's all you have to do. You can't be of any use. Thankfully, NHS England are lovely and found me something to do, because I think they heard my pleas for, please let me do something. And I spent a lot of my time in my kitchen teaching care homes how to don and doff PPE properly. So the amount of times my partner walked in and I was fully PPE'd up in my kitchen teaching people how to take gloves off was numerous and very odd. And I was able to write a couple of policy documents, but ultimately I felt like I wasn't really worth anything, especially to the trust that I was in and the people that were my managers at the time. I think when we got through and we got the amazing news that a vaccine was coming, there was real hope, and I did the right thing and went and got my flu jab and got very excited. Had my flu jab, and 10 minutes later I was being blue lighted into A&E, not being able to breathe, having gone into anaphylaxis, because apparently my condition now doesn't like vaccines all that much. So I then had to go through the realization that actually shielding for me didn't seem to have an end date to it. And even when there was the government guidance that this was stopping, I had no protection. So for over 15 months now have remained shielding. Thankfully, I have a wonderful consultant who has been able to fix me enough to be able to have my first dose of vaccine. And I'm not going to lie, I cried all day. Every single person that I met, every doctor, nurse, HCA that I came across, I was like, I'm so happy, which was lovely. But I don't think I realised the impact it had on my mental health. That not only did I have the guilt of not being able to help, I didn't feel like I was overly valued and that I was of much use to anyone. But also it was that thing of, it was really traumatic. Having your first pregnancy in a pandemic in itself is really difficult. It was traumatic that my support networks were taken away. It was traumatic that I was shielding. But because the majority of my support networks, my friends and nurses who have gone through exponentially worse on the front line than I have, I don't feel like I can speak to them and say, actually, my 15 months were really hard and really traumatic, because in my mind, they've gone through so much worse. They've, had to call families telling them their loved ones have died over the phone. And it's, all the things that go against us and bring that moral injury are very much there. And it's it was really difficult. So I don't feel like I've ever been able to share the trauma of the past 15 months with anyone, because the people that I would share it with, in my mind, have gone through so much worse. But on a positive, it gave me some time to reflect. It made me realise that actually going back to frontline nursing at the moment isn't realistic. So I started a new job within the NHS, which I absolutely love, and it was probably the best thing I've ever done. And you know, everyone that I know is happy and healthy and vaccinated, and you know, we've got light at the end of the tunnel, and it's feeling so much more positive than it was this time last year. But it's now that I think everyone's stopping and starting to get back to normal that they start to realise what they've gone through in the past 18 months or so. And I think it's now that everyone's starting to truly understand the impact COVID's had, especially on those shielding people, and the anxiety that I think we all still have. So the thought of going to a supermarket for me at the moment is terrifying. The thought of being around that many people, I don't have a problem with being outside. It's not that agoraphobic side of it, but the thought of being around that massive people that I don't know, that, you know, every person that I see at the moment, it's a calculated risk. We all take a lateral flow test to make sure that we're safe, because I'm trying to keep myself safe and my family safe. So that anxiety is still there, and it's difficult because you don't have your normal support networks anymore, and you don't want to bug those people who've been working on the front line, who do become your second family. And I'm sure everyone on this call can really resonate with the fact that your NHS family or your healthcare family is you spend more time with them than you do your own loved ones sometimes. So when they've been through a trauma and your trauma doesn't seem quite as fitting, you don't really have anyone to turn to. So I think this is just a really amazing forum that I think a lot of people can resonate with and need the time to kind of sit here and just go through and be okay to say that, yeah, you've gone through a trauma, but it's okay to feel that way, I think. So, yeah.
Thank you so much, Susannah. I think we're going to hand it. There is one hand up. If it's a technical question rather than a question, Rachel, your hand. Is it something about the system rather than a question to Amy? Because we have got space at the end for questions for Amy and the other speaker. No. I
think let's keep going, Claire.
Okay, fabulous, Amy. And I must say, I've known Amy through my role in the NHS Assembly, and Amy is very modest, but she's one of the most amazing, I was going to say nurses, but people that I've met, who has given much support, not just to neonatal nursing, but to me in the Assembly with your massive insights. And throughout the Assembly, and the Assembly predated COVID. So Amy was our first baby. I mean, your baby was our first baby. So as the pandemic was wending its way through with all this negativity and deaths, Amy brought her newborn remotely to the online meetings we had. And I just want to thank you for that, because you brought us joy. It is our baby. I still think you should have called it Simon Stevens, but
maybe the next one, if we have one.
So Susannah, do you want to introduce our next speaker?
Yes, I just want to see, Fidelia, if you can just put on your video at all. We'll see if this works, but I will introduce Fidelia. Fidelia is a brilliant matron midwife at Barts who has also shielded during this pandemic, and Fidelia is going to talk to us about her experience of shielding. But Fidelia was also part of a support group for shielding staff that Barts Trust organised. And we are going to ask Fidelia to explain and describe what these groups were like. However, it might be that we have a few technical difficulties at the moment. So Claire, I wonder if we could maybe move on to talk with Mary and Fiona while we get these technical difficulties sorted out. You're on mute, Claire.
Fidelia, if you want to, if there is a technical problem, my usual solution to it is really, really technical, which is switch it on and off again. managed to fix all my IT problems in that respect. So let's wait a little while in case Fidelia does come back, and then we can have questions to Amy. But I wonder if Fiona and Mary, you want to talk about, or let me introduce you both. So you're two wonderful people who are going to help us run the groups, and these aren't therapy groups per se, that we're not providing therapy. We are providing therapeutic spaces for people to come together in small spaces, not big uncomfortable ones, to actually talk about what they're doing. I just wonder, Fiona and Mary, whether you want to, Mary, Fiona, you start because you've got yourself off mute, just introducing yourself and what you'll be doing, and then maybe if there's some questions that need to be asked, and then if hopefully we'll have Fidelia joined us by then.
So hi everybody, so I'm Fiona and I'm actually from Northern Ireland, and I work in the NHS as a group analyst in mental health psychotherapy, and I've been very lucky to be working with doctors in distress. So this will be my third group that I'll be running. So I have run a group for doctors and nurses in intensive care units across the UK, and also I'm currently in a group working with people with long COVID. And it is very much a safe space for people to come together and to talk and just to develop relationships with each other and to learn from each other and to share. And the biggest thing I think is to know that you're not on your own with all of this stuff, and maybe be able to speak about some of these things in a way that there's not been a space to speak about them elsewhere. And I think it's important in the way that Amy was talking about whether it's a trauma or not. I think everybody has experienced this pandemic in different ways. And all of it has been traumatic, and it is really important to find a space to talk. I encourage people to come along and to talk, but you don't have to talk if you don't want to. But it is helpful sometimes even just to say hello. And also, if you come late, please come rather than not come. That's really important as well, because I do realise sometimes other things get in the way.
And Mary.
Hi everyone, my name is Mary and I am a group facilitator with a background in psychodynamic psychotherapy. Amy, I found it so interesting listening to you, because I was trying to imagine what it was like to manage this series of events that started off with the immune system issue that arose, and then to become pregnant, and then to go into shielding, and I was listening to your personal story. I was also hearing the voice of the nurse, that it's much worse for them. You know, it's not, I just wanted to, I think, just chime in with what Fiona said about this being a space really just to listen to others and to, you know, low demand. It's just a kind of space to come in and talk or listen. And I do think that coming out of shielding, I was thinking about it the other day, and it felt to me a bit like sort of objects that have been put away carefully, wrapped in newspaper. And now we're, you know, the newspaper can come off. And it's actually quite a delicate thing, this kind of thing of coming out of isolation. And I think just to, as Fiona says, turn up. All you need to do is just turn up, and you will undoubtedly hear something that will help you. So
people have asked questions in advance, and Fiona and Mary, and one of the main issues is around confidentiality. Now, clearly, a bit like this is being recorded, you know, people can say, well, I won't, you know, I'll keep it confidential, but do things anyway. I mean, what's your sense about the groups? Because you've run some pretty some very sensitive groups, both of you, for us. So you, Chris, you've run Mary, you've run the groups for ITU staff, and Fiona, you've run some of the long COVID. Fiona, what's your sense about confidentiality in groups? What can you reassure anybody that might be anxious about that?
I think that the confidentiality is a really important part of it, that what you talk about stays in the group, and people do make sure that they're in a very quiet space, and often it's really helpful to use headphones as well, so that if anybody happens to come into the room, they won't hear the conversation. Obviously, if somebody's really struggling and they do need some support, then we can talk about that, and then a referral can be made elsewhere. So it's always with your consent as well. And I think it's managed quite well.
And I see Fidelia has joined us, but Mary, what's your, there's another question, not necessarily about confidentiality, but something I suspect you see a lot in the group. Some people just don't want to speak in a group. So do people in a group have to speak? Is there a sort of, you make them all go round and say something, or can they just not? And if they don't say anything, does that mean they're not participating? What's your sense of this?
Well, okay, my own view is that turning up in the group is the requirement, and that's it. You do not have to speak. You can just go there and listen. There is no requirement. It's not a social gathering, and neither is it a therapeutic gathering. It's sits somewhere quietly, comfortably, safely in the middle. And it's just really, you will hear things that you need to hear because other people have been going through something different to you, but there will be real overlaps, real similarities. And they will also understand this issue about being a health professional and you know, sharing about your vulnerabilities, and the pressure upon you to always be in role. So yeah, that's what I would say, Claire.
That's fabulous. I mean, I began the training as a group analyst, and there's one thing about being in a group is that it helps mirror what you're going through. You're not alone. You can give and gain support, and just connecting with people, even if it's remotely, though especially if it's remotely, because I think remote has actually helped us all. Fidelia, thank you so much for logging in. I gather you had some IT problems. I hope that my solution worked, switching it on and off again. I promise you that is the answer to everything. Somebody suggested some very complex thing on Twitter, and I said just switch it on and off again. So, but thank you so much for joining us. And I understand you're a midwife, so clearly midwives work incredibly hard. And I know that from my work previously that midwives have really quite high rates compared to other nurses of post-traumatic stress disorder and other conditions, and yet you have to just continue smiling and doing the wonderful job you do, come what may. Now we've heard, I don't know whether you heard Amy's wonderful talk, we've got about 10 minutes for you just to talk about, because I understand that you've been shielding during the pandemic and have been part of a group that's been supporting each other. And I just wonder what your experience is of not just shielding, but being part of a support group. If people are reluctant to think about joining a group, you know, what you've benefited from it, and what's your sense?
Thank you so much, Susan. Thank you, everybody. Apologies. Thank you, Claire. My apologies, I was a little bit late. My technology here is wonderful, so I'll just keep playing with it. Can you hear me, though?
Absolutely perfectly. Must be on an NHS computer if your technology is bad.
No, I'm on my phone. It's not working. So, yeah, I am by profession. I am a nurse, a registered nurse, and I am a midwife as well. I have been working as in the general nursing aspect, but I've been quite close with my colleague midwives and have heard their own versions of the story. It was quite challenging during that period because I never really expected in my life that I would be told to shield from a disease. You know, considering I was trained in Africa, I've had tropical trainings. I've worked with very highly infectious people. I've worked in infectious disease units, but I've carried pregnancies through all this period and never was told to shield. So being told at the first instinct to stay away from work, which I very much enjoyed, was the most challenging thing. And it wasn't easy because I was in senior role and I knew I could do much from home. Sorry about the interference, I'm in a warehouse. It wasn't easy getting to do things remotely, I guess because NHS wasn't in that space of mind yet, in that frame of mind yet. I remember very, very senior people telling me, it's okay, stay at home, do nothing. When you come out, there'll be work for you. You know, I know, imagine delivering babies from zoo. It was the most difficult thing. It was the most difficult thing and quite frustrating. A lot of people became depressed. However, when we started the SHIELD group and I shared my reflections of how I was feeling and how I was reaching out to colleagues who were equally shielding, as well as colleagues who were in the front line during this period, everybody kind of took on board the need for us to come together as a group. And for us to form that group, we had to set respect, some landmarks. One of them was respect everybody's opinion is valued. You do not judge anybody, and it's okay for you not to be okay, and that really helped the group. It really helped the group. We reached out. I heard in the beginning that there was about 600 of us shielding in my trust, and the group that we had was less than 30 at this time. So I pushed, and we started, publicizing the group, encouraging people. But the biggest challenge was the fact that not a lot of people had Wi-Fi's in their homes. Not a lot of people could access their NHS emails from home because they've never practiced doing it on their mobile devices. So we had to go and plead through information governance to get people's details, private personal details, reintroduced ourselves to them and encourage them to come. And a lot of people attended when they realized that we were speaking to issues that touched them, that we were not just prescribing solutions. Together, we were all crying if we had to cry. And it was okay for you to cry. We gave you that opportunity. And together, we shared everybody's burden and carried ourselves on. One biggest thing that came across, for me, my biggest learning in the whole thing is the fact that 90% of the people in that group that we eventually formed, I did not know. So I got to know more people in the trust through the pandemic. And the fact that I looked forward to that group every week, I wanted to attend because it gave me solace and respite. It kind of lifted me out of my mess and made me happy again in myself. It didn't just provide me a work link, but it provided me that emotional support. And within that period, I was able to develop a few skills. So I kind of started participating in facilitating or learning how to facilitate, and got training into being a coach. So it kind of made me much more wholesome, because now the insights, currently I work as the head of nursing for a mass vaccination site, and the insights that I had from my shielding time makes me much more tolerant of colleagues, of people I deal with every day. And there's no kind of behavior or attitude somebody will bring that I don't think I can manage. So, and it just takes that part of me that I have learned during the pandemic, which is being more compassionate, compassionately listening, compassionately asking those questions, and not, critically attacking or pushing the person to be task-oriented, but finding out what's making you struggle with this, And right now, I still keep in touch with everyone who's been in that shield group, and we still have our groups that we still meet. We still meet on a weekly basis. Something I forgot to say was the meeting was every week, once a week on Monday, 2 to 3:30. But then we also developed, I managed the choir group. So we formed the choir group and we met on Friday evenings with a glass of wine, not the kind of choir that sang in the opera, but the kind of choir that just literally sang to uplift the spirits. We had Facebook groups, people who wanted Facebook chats, and we had cookery, we had newsletter. So these kind of things really amalgamated the team. And I still hear from people who never knew we existed. and who still want to go back to the archives of what happened, because they felt that that journey will build them up. Thank you.
Well, how wonderful. And the only choir I've ever done on Zoom, cats calling. And I realized that these Zoom choirs have to be so well orchestrated, literally, otherwise you're just beyond belief. But thank you so much. And thank you, Amy, and thank you, Fidelia, for your fabulous hard work, not just during the pandemic, because you have been working hard, but before that, because I think nurses quite often don't get the praise and the thanks that that they should do. So I'm going to hand over to Susannah, because I mean, there are, Susannah, just we've interposed Fidelia, but there are other questions possibly that around the groups, but maybe there's some questions that want to be answered, and then we'll loop back. So over to you, Susannah.
Absolutely. So we've just had a couple of questions for the panel. So the first one I think will be for Fidelia and for Amy. So do you feel that the level of support during the shielding was sufficient? Amy?
I wish I had been at Fidelia's trust, because if I had that support, I would be feeling much more, I'd be feeling happier about it. So from my overall trust, they were very good at just checking in. I actually got more support from my GP. My GP was amazing. They rang me every couple of weeks just to check in and make sure I hadn't lost my marbles. And obviously I was still seeing my midwife at the time. But from my actual day-to-day contact manager, so my line manager, from the minute I was shielding, I didn't really hear anything from her, apart from if it was something that was needed for occupational health or HR or that kind of thing. So if we got a letter about shielding, I needed to send that in. That was pretty much the only contact that I had. So from one aspect, yes, I was supported, but from the people that it mattered who should have been supporting me, I would say I probably wasn't.
Fidelia, I know we've heard about your support group, but what would you respond to that question?
No, from the trust perspective, I think what we noticed was the massive confusion. Nobody really knew what to do with whoever. And people were at a loss from the front line. The very senior managers, for once, didn't really know what to do. And so we kind of, in our group, there was just about 8 of us in the beginning. We kind of took ownership of the role and decided to actually tell our leaders what needs to be done, what can be done, and they listened. We invited them into meetings, invited them to sit in with us and hear us out, and they listened, and they knew that the only way to get it right was to listen. So they listened to us, they listened to the frontline team, and they did try, in honesty, they did try to get it right, but they didn't, because the reason being communication and the hierarchy, the fears. So we know in NHS we have hierarchy. So the top governing team will agree, yes, this needs to be done. But by the time it's cascaded to the direct line manager of the shielder, it's been changed in millions of ways. So those were the challenge. The biggest challenge was the communication of the agreed plan to be actually put into practice. So this gave us another line of action, which was the middle managers having a meeting with the middle managers to support them into what needs to be done. So it wasn't straight sailing or clear sailing for us too. It was up and down, but we kept at it. We didn't give up.
That's brilliant, Fidelia, and thank you, Amy, too. We have another couple of questions. So first one is from Anne, and it says, it's so moving to hear all of you talking. As someone who was shielding, I'm interested to hear how completely different the workplace is now, well, if you have come back from the one you left, and how you coped with this. Amy, I know you've changed jobs, so it might be a slightly different.
Yeah, so I have changed my job. So I, going back, I think I would have struggled if I'd gone back clinically, because I'm still in that, technically still in that vulnerable area, and because it's taken me, so I mean, Claire will know this because I posted a very crying, happy face on Twitter where I got my vaccine about a month ago, which was wonderful. But up until that point, shielding had been stopped. So actually, I don't know how I would have been able to go back to work safely, because technically the government guidance that everyone was working on had gone. So it would have been a case of, would I have had to have gone off sick? Would I have been able to go back? I know that even just, I mean, I've still got friends who are working there, even just the social aspect of it, you know, you can only have so many people in for a break at a time because of social distancing, and you know, the buildings haven't adapted to COVID. You know, buildings don't know that you have to keep 2 meters apart when you build them. But I know for my colleagues, they've really struggled with, you know, especially in intensive care units, you can't decide when your patient's going to be sick or not. So, you know, saying that you're going to go for lunch at 12 o'clock is not ideal if your patient decides that actually at 12 o'clock they're going to be really poorly. So it means that I think the well-being, I think there was a lot to do with, there was a lot of talk about wobble rooms and mental health support, but I actually think on the ground support for staff hasn't been there in the realistic terms, and I think if I went back to that, it would be really difficult for me, because I'm one of those people that I like to fix things, and I'm sure I would get in a lot of trouble with bosses by being like, no, we're going to do it this way, you know, it's fine, because how I care for my staff is more important, because you know, there's only so much you can do before you burn out. But at the other end of it, going into a new organisation, I've not actually met anyone yet, so everything has been done virtually, so everything is done on Teams, so I've not met anyone in physicality yet, so that would be nice when I do. But at the same time, the flexibility that they've adopted, and they're an NHS organisation as well, you know, if I have a bad day with my condition, it's not a problem, just take the day. You know, their theory is, as long as the work gets done, we don't care how you do it, you need to look after yourself because you're the most important asset that we have. And I don't think that's always transcended across the NHS in general.
Yeah, that's really interesting. Thank you, Amy. And Fidelia, I believe you're working in a vaccination centre. Is that right? Yeah. So how has it been coming back to work, firstly to a vaccination centre, but also after shielding, you're in kind of in the front line again, you know, how has that been?
So from the first time I you know, when the shielding was called off last year, I pushed to come back to work, and there was so much resistance for me to come out. Eventually in September, I went back to my old job, and there was a lot of crying when I got there. And but again, technically, people were ready for me to come back. I wanted to come back, but when I physically got there was really no assurance around that protection. I'm not a unionist. I don't do union. I tried to sort it out first, and I had to take people up actually. And the reason was because there was really no plan. There was occupational health outline, which was completely flaunted. And I don't mind, you know, I didn't have an office to work out of for a while. I literally was a roving matron. And then we had to go, I sorted myself out. I pushed and sorted me out. But then we had to go back into shielding. And so because we were going back into shielding from me being out, I took all my work home. So this time I wasn't going to beg anybody to allow me work remotely. So I took everything I had to do home, except the delivering babies. So I had my team, I had to manage my team remotely. and I attended meetings remotely, and I set up all those meetings because I knew I had a lot to contribute to it. Then with the second shielding, I was kind of volunteered to go and work with the vaccination group. And I think it was something that was done, get out of our way, keep out of our way. You can't come back. It's too dangerous for you to come back out. And I think I just said, you know what? If that's the new role I'm gonna play it with vengeance. And I went in headlong and I worked remotely. I did the interview, recruited for the vaccination site, and also managed the health roster, which I could remotely. So it was quite shocking that I had to push to do all that. But then I had very junior staff who again were shielding and were back in the same boots. So what I did then was, even though I was no longer at my old job, still part of the group, I connected them to their managers, got their managers to set them up remotely, give them accesses to computer, flagged it to our people's head lead. And he supported, people could do remote phone calling, bookings of appointments, and email responses, manage mailboxes remotely. And they felt part of the team. So the isolation we had in the first time shielding was really reduced in the second time. And it was just due to the effort of the shield group. It wasn't just me, it was the effort of the shielding group who kind of prepped people, pushed, knew then what buttons to push,
Yes. I mean, what already in the question section, it shows the power of the group. I know somebody, I think Rachel, very kindly answered somebody else's question about an HR issue, but also the isolation that people are feeling. I know Rachel's put a question about Wales and about shielding people aren't allowed back into clinical work, whereas in other places you two have shown. I mean, Fidelia, you've shown you're in clinical work. You're actually probably one of the most dangerous places because you're in a place that has people who are not vaccinated. And, I was there back in December when we had 90-year-olds who've been out for the first time, but that's the most risky place. But the group isn't a lobbying group, but it is a group space. And we found this for the long COVID group, and maybe Chris or Fiona might want to say something, that actually by sharing experiences, it also empowers others to think, well, this isn't right. Why am I not allowed to do clinical work when we've got an example here of somebody really in a clinical area that, if you're going to be infected with COVID, you'll be infected with COVID. I suspect, Fidelia, you've had your vaccine, so you don't have to disclose it, but I suspect you have. So,
yeah.
Fiona, in your experience, these aren't places to lobby or to change national opinion, but they are spaces that can bring people together to realise that they themselves, their experiences on the margins, and really they can then be empowered by saying, well, such and such and such and such, and actually design their own destiny. Is that something that either of you, Fiona and Mary, have seen?
I think that's really important because certainly in the long COVID group, people have been talking about how their trusts have been managing their sick time, and some trusts have actually not classed people as being sick because it was been a work-related injury. And I think that's been really helpful to know that these things are possible, because then other conversations can be started to be had in other places, and to hear what's good protocol and what's not. I think it has been helpful, but it hasn't been done in a lobbyist kind of way. It's been in a conversational way that people have been learning from each other.
And the same with ITU, Mary. I mean, I suspect it's slightly different feelings, different issues, but therapeutic impact of a group is to know that you're not in it together, but also know what's different, what to expect.
I think it just broadens things out a hell of a lot, because I think you're just left with your own situation and you're dealing very often with one other person in a senior position. And I think to be in a space where you can hear other people's experience, how they might have navigated some of this. What I'm hearing today is how different the trusts are, you know, and then it so much depends on the immediate person that you're talking to as well, even within a trust that might be less warm, or, you know. So I think it's incalculable, actually, in terms of, I think there's two things that you can get from a group in this kind of situation. One is some restoration of confidence, which I think has taken a hammering, because you've been de-skilled during this process. You're not able to refresh your capabilities each day. So your restoration of confidence and hope as well, the installation of hope. So you're showing across the room someone who's been in a very tricky situation, and you just, it's like, wow, you know, you suddenly begin to see that little gap that you can, or that approach from the side. I mean, who knows where it comes from? The most unlikeliest person says something that proves to be just what you need to hear. That's what I've seen in groups. You somehow hear something that you've needed to hear. So I say again, don't ask if you want to go to the group. Don't make a decision if you're going. Just turn up. That's all you need to do. Don't ask a question. Just go.
Thank you, Mary. Claire, did you want to pop in?
No, that's over to you, Susannah.
Yeah, no, I just want to say thank you, Mary, because I think those 2 points are really crucial, that these groups are somewhere to share, to realise you're not alone, but it's also to give you the tools to rebuild that confidence, to go into a world like Amy, that you said that you've been hiding from effectively for very good reason. But I think that's such an important point, and that one of hope as well. I think as the vaccines start to work and restrictions start to lift, that kind of feeling of hope is something really important and something that we can all relate to. We have another question. We've got about 10 minutes left, so if anyone does have another question that they want to ask before we wrap up, please do put it in the question box, in the chat box. But another question is about kind of people's attitudes who have been working on the front line all during this time. So how do you think that we can change the behaviour of those who worked through the pandemic to understand that our difficulties people have been shielding are real, even if different from their own? Amy?
So I can completely understand this question, and I'm sure everyone who sat on this has seen the quote, and I don't know who wrote it, that we've all gone through the same storm, but not all of us were in the same boat. So we've all been through the same trauma. We've all just been through it in very different ways. And I think it's what Fidelia said. It's talking with compassion and having compassion when you're talking to one another. So I think frontline workers who have gone through this pandemic and have gone through whatever the government says, I would say at least 3 waves now, especially if you're in the north, definitely 3 waves. They have been battered and bruised. They have gone from being clapped on doorsteps every Thursday to being public enemy number 1, and the tides have changed a lot, and they're exhausted, and they're also being expected to go back to a full service without having respite from what they've just been through. So I think what they're probably projecting onto you with maybe not being able to understand what you've been through shielding isn't a reflection on what you've been through. I think it's a reflection of you're probably the safest person they feel that they can have that feeling too, if that makes sense. So, you know, for example, if my sister is angry at me about, or is angry in general about something, the person she's going to take it out on is me, because I'm the person that she feels can understand, but also can almost take the grief that she's going to give me. It doesn't mean that it's right. And I think we just have to bear in mind, if they don't understand our situation, that actually right now is probably just because their emotional resilience is at max, and to take on someone else's idea of trauma is quite difficult for them at the moment. All we can do is you know, and this is why these groups are great, is probably be able to share how you're feeling with people that can understand. Because I think unless you have shielded, you can't understand why people would get angry. You know, I drive down the street and see people wearing their masks under their nose, and the rage that fills me is huge. And you know, my partner gets it because he's had to shield with me, and I'm like, why can't they just do this one simple thing? I have stayed away from family and friends and loved ones, and you know, I've got people who've never met my baby 15 months down the line because you can't wear your mask properly. So you have that rage, but it's just, I think your frontline colleagues probably just don't have the capacity to understand it at the moment. I think give it a year, when they've had a bit of time to reflect, they might be able to have that conversation. But it's finding out that safe space, and I think this will probably be one of those safe spaces.
And I think you're so right. I mean, the equivalent, I suppose, you mentioned, sorry, we've got noise as well. The equivalent is, as you said, the clapping for the staff at the start of the pandemic, and now the massive increase in complaints. And being a GP, I'm spotting that, a massive increase. And whereas we're all in this together, being a health professional does not mean that you have not experienced the same losses, the same grief, the same emotions. And it's somehow, and what you two have done so beautifully is express you're human too. The fact that you are health professionals, the fact that I'm a health professional doesn't mean that I haven't suffered, as we all have suffered. And so I think the message you two are giving is, here we are, we've been in the same position, as well as the people that are asking the question. So you're absolutely right. Sorry, Susannah, I just felt that moved me to comment what Amy said, because it resonated with me, because I'm struggling myself with my GP hat on with a number of complaints that I'm getting personally, trying my best, let alone the rest of my 50,000 colleagues who are trying their best, because people are in a position now, as you said, Amy, so eloquently, that they're wanting to find somebody to blame, and the easiest person to find is to project it into a caregiver. As mothers, for example, we're there when our children are frustrated, we receive their anxieties, and I think we're in that position. So yes, thank you for saying that.
Well,
Fidelia, do you want to add something? Yeah.
Can I just say, in addition to what Claire and Amy has said, there's something, you know, we noticed the animosity. I mean, you can't equate it. Is well above, is out of scale completely, can't measure it. And the only thing that we did, or that, you know, we pushed for, was we knew our trust was doing a kind of a recovery meeting, a recovery sections with all the teams. But again, that recovery section was mainly for people who were in the front line. So those who were shielding were again isolated. And I think I made a very, very, very strong case. And I said there's already a dichotomy between these two bunch of people. And the best the organization can do is to bring them together to heal. And so if I belong to Team 1, if Team 1 is having an away day, I should be allowed to Zoom in or Microsoft Team in and tell my own end of the story, and let them hear how emotionally distressed I was, that they had to work and I had to let them work, and some of them were sick and some died. So, you know, I think only a few people took on that, and it helped. I did it with my own team. I did it remotely, and I know there was no dry eye in the room when I spoke about how I was made to feel unwanted, not part of the team, completely isolated. You know, if I talked about something, you are bringing problems, you are the problem, and you're not the solution. So that joint meeting, that collaborative meeting with a shielder and a non-shielder kind of starts putting things into perspective. I didn't just sit there changing Netflix channels or Disney channels. You know,
I'm shocked you didn't do that. I mean, I watch everything there is on Netflix, including the adverts.
Claire, some of the things that I heard when I had my first mitigation meeting, one of the first things was, this is really not fair, especially when we were going into the second lockdown, the words I heard from Frontline was, "This is not fair. It's our turn to go on holiday. Why is the country going on lockdown?" Exactly. But that was from somebody who I think didn't understand. I wasn't on holiday.
Yeah.
I was not on holiday.
You're so wonderful, both of you. If you ever want to move down to South London, land. Anyway, Susannah, over to you.
Yeah, no, I wanted to say, and I think this is backed up actually by just a message, like a comment we've got in the group from Donna, who's just agreed with what you say, that it didn't, she said, I'm sat at home and it didn't feel fair to me, everything that was going on. And I know, Amy, you've touched on the guilt, Fidelia, you have as well. And she was saying that actually from her trust, she didn't receive any kind of pressure or guilt there, but it was the guilt that she's felt herself. And I think that's something that I hope, and I think everyone in this call will be able to relate to. And I hope that you'll be able to share this in our groups as well. Sadly, we're at the end of our time. We've just got 4 minutes left. But I want to say thank you to everyone, to Mary, Amy, Fiona and Fidelia, and to Claire for sharing your experiences. I think it's just been a really powerful time, and hopefully a time where people felt that they're hearing things that they can really resonate with. This isn't the end. We have groups. So our groups start on the 23rd of June. So that's in 2 weeks' time. Anyone who wants to come is more than welcome. If any of you know anyone that isn't on this call, but that is a nurse, HCA, midwife, physio or occupational therapist that you think these groups would be of benefit, please do come to our groups and share with us. We will send out the registration details again after this webinar. And we've also recorded the webinar, so we will send that out to everyone so you can share it far and wide so we can get to as many people as possible. Amy, you mentioned, or was it Fidelia, that a lot of people don't have access to their NHS emails at home. So we want to get it to as many people as possible. The groups I've just seen, the groups are being held online. So what we'll do is, you're signed up to the registration page as you're on this webinar. What we'll do is we'll send you a Zoom link just 2 days before the group starts. So that'll be the 21st. So you have that ready to go. So unless, Claire, do you want to say?
No, just listen, these groups are spaces for you. You've seen the two facilitators, Fiona and Mary. They're wonderful, experienced people. These will be small groups where you can just come and be part of a support system. And we will close the groups. There won't be new members joining you after the second one, so that they remain a space where you get to know and gain confidence. But so there will be spaces, and hopefully we will be running these in the real world at some point. But at the moment, sadly, there are good things that happen with remote because you can meet them. And they are spaces for you to tease out some of the issues. You may actually not talk about shielding at all. You might talk about the pressures of being a healthcare worker or a nurse. But what time will they be?
5:15 to 6:30 p.m. on a Wednesday.
On a Wednesday. So that's a day traditionally that is the quietest day of the week. Ha ha ha. So I just want to thank everybody for coming, Susannah as well, and Doctors in Distress, a charity there aiming to reduce the rate of suicide amongst all health professionals. And one little plug, the book Beneath the White Coat, Doctors, Their Minds and Mental Health. If you want to learn more about the mental health of the workforce, all donations to charity, written by myself, but that's nothing to do with me. It's all donations to charity. Doctors, Their Minds and Mental Health, Beneath the White Coat. Thank you so much, everybody. Look forward to seeing you in 2 weeks. Lots of love.
Thank you.
Keep safe and try not get COVID.
Thanks, everyone. We'll
Bye.
see you in a couple of weeks. Bye.
Paramedics are also included, sorry. Thank you, everybody. Thank you, Fidelia. Thank you.